Good morning, everybody. Welcome to Three Essential Questions. I am Pam Myers with Pam Myers Social Media, and my co-host is Erica Yoakum with Virtual Personal Assistant. We do this every week, and we have different guests on. We ask the same three essential questions of every guest, and we record it, and then we share it on various social media platforms. So if you would like to be a future guest on our show, please let us know. And today our guests are Gabe and Mark with G&M Medical Center. Welcome, Gabe and Mark.
Thank you. Thank you.
Yeah, we're so glad to have you join us. And so the first question of the day is, what have you both learned about yourselves during this whole COVID pandemic?
Basically managing stress levels for the most part.
Right.
Sometimes being cooped up. Exactly. Cooped up in one area tends to add some more stress, but it's learning more about each other as well, which was really great.
Yeah, cool.
Yeah.
So have you found go ahead, Mark. Go ahead.
I was gonna say it's been challenging just for me because of being at the provider with all the COVID. You find yourself more aware of your signs and symptoms and things that you should be concerned about. You're more focused on yourself staying well than you would ever before, so you try to, it's more about your health as well, first and foremost. So we just kind of focus on ourselves first, and then our patients. But
oh wait, are you saying that you had COVID?
No, but I'm around COVID patients a lot.
Right. Okay.
So, yeah. So I want to make sure that I stay safe.
Right.
They stay safe. So it's super important for us to do that because so you have to be aware of your surroundings and your personal health. So you don't look at any symptoms lightly. You take it seriously. So
Right.
it's super important. So that makes you more aware.
Mm-hmm.
I think that's what's learned for me more so is just being more aware of a lot of things, so.
Yeah. So have you driven each other crazy, like in lockdown? There's so many people I've seen, like I'm used to it. My husband and I, we've been virtual forever, but there are people, you read these stories and then people are like, I didn't know how loudly my husband chewed.
Yeah. Not for the most part. We've always lived together, worked together, everything. So it's basically been the same.
Yeah, when our clinic was pretty much shut down, a couple of months ago, we just focused on projects at home and, working in our backyard and building a pond and wood enclosures and more gardening things, that kind of stuff. So we stayed busy for the most part. Yeah.
So you were closed down for a period then?
Pretty much. I had very few. I could stay as a primary care. I could see a few patients, but most patients weren't coming out, and I was very picky about who I saw. We do virtual appointments for sure, but people just weren't, it wasn't, it was just kind of locked down-ish. We hardly had anything going on.
Yeah. Yeah. I would imagine that presents a whole other set of challenges trying to.
Well, yeah, we changed our hours, to just a few hours in the afternoons and or in the morning to the afternoon, because it just wasn't nothing happening, Everything in our building here was closed as well. So there was no traffic, there was no nothing. So.
Wow. Uh-huh.
And then I was working at a testing center. I was testing thousands of people a week, so that left me, I was working a lot of hours, which is because where I was at, that was what I did. And so the clinic wasn't busy, so I focused on helping out the community with the COVID testing and stuff. So yeah. I was swabbing people about 1,000 to 2,000 a week.
Wow.
Yeah, talk about front lines. Well, thank you for your service with that stuff. That's it. I mean, I'm sure it was totally crazy too.
It was, yeah. The line, the first month, the line was 2.5, 3 hour wait just to get your, So it was lined up all the way through Optum, all the way down the Journal Center Drive, all the way down Jefferson. So the average wait time was 2.5, 3 hours.
People who are already upset and freaked out and everything else.
Oh yeah.
Tempers are going and, oh my gosh. So, wow. And you stayed sober through all of that. That's impressive. I don't know.
I had no choice because I couldn't go nowhere. So.
Well, that's true too. That's true too. So how have you how have you responded to this? How have you kind of dealt with all of this? Do you have any coping techniques you want to share?
Not really. I mean, we both, I mean, the biggest thing for us is just is really to stay safe. As for us, I mean, if I were to get the virus, and obviously Gabe would probably get the virus, and we had to shut the doors here, then I couldn't be working at Optum Health either, and so it would have been a big crisis for us, and so that's something that super important for me to stay healthy. I'm very strict about who I see at the urgent care, and I'm very strict here as well who I see. We screen here. We've got we have really stringent policy here and screening process because we want this clinic to stay clean because we are a med spa too, and so that's super important. We're a little bit closer to the patients, and I want to make sure they're not ill. The most challenging thing for me doing this whole thing is how the patients just lie about their symptoms. So, and that's frustrating as heck for both of us because, they'll lie on their screenings questionnaire we send them prior to their appointment. And then as soon as they get back to the room, they just got tested yesterday, they've got a cough, but they lie just to come in and get their little chronic problems taken care of. And that's frustrating for both of us because he's up front with them before I see him, and they've lied to him all the whole process. And I get them back in the room. Next thing I know it, they're like, they got screened yesterday. They've got symptoms, and and I'm like, ah. So we have to. Then at that point, we have to clean the whole office, sterilize, spray, wipe everything down because we just don't know. So that's frustrating for sure.
Yeah.
Wow, I hadn't even thought about that. I mean, because I'm a big dork, I walk up, they go, we want to take your temperature. I'm like, sure,
Well, they've been asked so many times. So the patients know the questions you ask, and they just answer no because they want to get seen. So they're conniving in a way, but they got to get seen. They don't even want to do virtual, which I'm more than welcome to do, but they just want to be physically seen, and they'll answer no to every question.
Wow.
Even though it's a yes to a lot of them, yeah.
So wow,
that's crazy. It's crazy out there, that's for sure. So
yeah, that's got to be very scary to deal with, not knowing if people are being truthful and they're coming into your office. And then
exactly.
Okay, I got a follow-up question. Are these folks that would I mean, you probably can't answer this because there's HIPAA and all that, but people normally lie to you to get in to see you? I mean, or is this an extent? This is just they're freaked out and they know.
It's a COVID thing. Yeah, okay. Absolutely. So they know the questions, they know how to answer them, and they know they'll get seen. So they have no problem putting no down there. It doesn't mean anything to them, but they want to come in and get their medication or whatever they got to get done. But it's nothing. They're not that sick. It's just chronic conditions that they're being seen for, but they feel the need not to be truthful about it, which is frustrating.
And dangerous. I mean,
all of us at risk, or if somebody else that's in the waiting room or coming in, they just put a lot of people at risk, and they just don't realize that, And I do quite well once they get back to the room, though. They know how to feel about it, so yeah.
Right.
Good. I hope you cracked the whip.
Yeah. Do you have to go home and like completely sanitize or strip down and like many nurses and doctors do before they go into their house, or do you do that?
If I'm out, I don't do the testing center anymore, but during the testing center, yeah, I would just like go take a shower right away, and that kind of thing, spraying my shoes and that nature. Now I'm not really seeing any COVID patients, except for starting this week, I will be working at a COVID clinic with Optum a few days a week. So I'll be seeing people who are confirmed positive that need treatments and to be seen. So I will start seeing them starting Wednesday. Wow. And so that's through Optum Health. But I'm real protected because now I have a new gas mask now that I wear. And they put a special filtration system in at Optum that filters out all the particles and all that kind of stuff. So yeah, so it makes it a little bit safer.
Wow.
So Gabe, how do you feel about that? He's gonna go work in the actual front line.
I got used to when he was working at the tents, and he'd come home and be like, nope, go shower first. But it's just something that you have to adjust with, and we just want to make sure that, because our business depends on us not getting sick. So if we were to get sick, we would have to shut down our business, which would hurt us as well as hurt the patients not being able to be seen as well. So
Right. Yeah.
Wow,
Mhm.
craziness up there. So is it calming? Allergies, I promise. No, I'm not lying. It's allergies, really.
But do you really know it's allergies though?
Yeah, I do, and I'm going in for testing tomorrow. Yeah, so yeah, I've been taking allergy meds and been pretty good, but I have to go in for testing, so I'm off all my meds. So like right now, my belly button itches. Go figure. You know, right? TMI, I know, but it's like it's all weird. Just you're anyway. Where was I? Oh, is it calming down? Is it like are people?
No.
No, they're like are
No,
they staying? Are they the
No.
mask thing? If people are just getting it, or are they still fighting
we
it?
haven't had anybody have an issue with not having a mask.
That's
Yeah.
good.
But a few of our patients have had COVID, for
Mhm.
sure. We sent them out for testing or they've been tested and they're positive. We didn't see them in person, saw them virtually, of course. So, I mean, it's still out there. People have a lot of COVID symptoms and they refuse to acknowledge the fact that it could be COVID. So yeah, I've been at home for 3 months, but I went to the grocery store. I went here. So that tells me that you're exposed. I mean, no one's
Right.
free of this community virus. It used to be a travel virus, but now it's a community virus and it's everywhere. Somebody just coughing in their hand and grabbing a can of peas and putting it back on the shelf, you come back behind and grab it and you touch your eyes or something or stick your finger in your nose, whatever, and then you could get COVID from that because it lives on surfaces literally hours and hours.
Mhm.
It's a respiratory disease. The droplets hang in the air. You can walk into a droplet and get COVID from somebody who just sneezed or coughed. And if it goes through their, if they're wearing a bandana mask, which are totally ineffective, you could walk right behind them and just inhale that right away. That's how the disease does, and it's scary. It's still happening, So
I'm dealing with with folks who, well, the mandate says we have to stay 6 feet away, and if we stay 6 feet away, we're completely safe. I'm thinking, if you've ever met me and been close contact with me, you know that I could hit you if you're 6 feet away, right? Because I'm a demonstrative person and I'm loud and I talk big, right? You're
Right.
getting hit if you're 6 feet away. I mean, even
Right.
just carry it on the wind to you. 6 feet is not
Right.
enough, but
yeah,
well, that's the
Exactly.
mandate. That's all I have to do.
we turn so many people away at the urgent care with symptoms, and we're sending them over to what we call the Fury Clinic for respiratory, and they're testing positive still. So last week alone there was 8 people that we tested that said they had some symptoms or one symptom were positive. So it's still out there. There's still people are panicking. No one wants to get the virus, and there's some people that are more conscious than others. Obviously, some don't care. Some don't wear a mask. Like what?
Do you think do you advise everyone to get tested, even if they don't have any
Well,
symptoms?
yeah,
Or what's the rate?
it's funny because, if you've got signs or symptoms, yes, or been exposed, yes. If you don't know, because that test is only valid for the day that you took the test. So it doesn't mean that in the next 3 days you could test positive. The test is it's misleading
Oh, wow.
because it's a 50-50 shot. It works. It's not FDA approved. We know that. But they put it out there. But it's good for the day you got tested. So if you got tested today, you could get COVID tomorrow. And
Right.
but people are walking around with that piece of paper they had from 3 weeks ago. Oh yeah, I got tested 3 weeks ago. I don't have it. Well, I know, but during that 3 weeks, it's very possible and extremely possible. 55% of the population are asymptomatic with the virus, and so they don't even know it. And so
Right.
that's the big issue.
Wow.
And so that's why it's spreading so much. So social distancing is the way to do it. And masks do help. That we know that they're not foolproof unless you're wearing an N95. But social distancing is the key. You stay with your distance, you're fine. You really are. Don't get in that little 6-foot circle, and you'll be fine.
Okay.
Like
Wow.
Jerry Seinfeld,
And sanitize your hands a lot.
there are things that you do that everybody stays 6 feet away, right? Like there's the urinal, the ATM, and now COVID.
Yeah.
Exactly.
Stay out of the 6-foot circle. Yeah. Sorry. That's an old Seinfeld joke. Yeah.
Yeah. Okay. I like Seinfeld.
Yeah.
Yeah.
Wow.
Okay. Is it my turn?
Yep.
Yep. Okay. So what do you think your future looks like on the other side of this situation for the two of you personally and for the medical center?
Well, what we're seeing now is just like teachers are retiring early. So the same goes for a lot of private practices. We're seeing a lot of doctors that are retiring early. So we're having to pick up a lot of their patients at the moment. So in the past few weeks, we've picked up a couple hundred patients for the future, just that they lost their primary care because they retired early. So that's going to be an issue now, is that there might be a shortage of primary care physicians.
Yeah. The older physicians, nurse practitioners, like at Optum, for example, if you're over 65, you can't work, period, except from home. Because of the virus, and so a lot of the people are just retiring. So what's leaving a lot of primary care open spots. There's, and just in the last 2 months, there's been in our little neighborhood here, have been 2 doctors that are retired, and I'm sure it's because of the virus, because they're scared, and they should be, because again, they know these patients are never truthful, ever are they truthful, and so they don't want to get sick, so so yeah. So, on the other side of this virus, I mean, once, one of the things that we have to anticipate is flu season's coming up, and so, so flu season and coronavirus are the same symptom-wise. And so it's really going to be rough. Right now we're at a low, it's great, but flu season is starting at the end of August into September. And we are, now they're saying it may not be as bad because people are social distancing and wearing masks, but flu season will be upon us, and it's going to be hard to decipher between the two. We can't see these patients anymore that come in for the flu. The urgent cares are packed flu season wise. Our doctor's offices are packed during flu season. They have all the stuff that you can't do anything for. But now they're recommending everybody get the flu shot. I pre-ordered all my flu shots, and I'll probably run through them in like a day. Because people are going to be frantic about getting the flu shot this year. If that vaccine is developed, then that's another thing. Am I going to be able to give the vaccine? Is there going to be enough vaccine for New Mexicans? How are we going to do this? And that's going to be our biggest concern. And patients are going to be calling us and, I want the vaccine. How can I get it? Where can I get it? Yeah. So that's going to be something on the other side for us. And it's going to create a lot of business for us for sure. But it's going to be, we got to come out with a plan, for our flu type patients, and how do we decipher between the two? So. Right.
Yeah.
My question on the vaccine, and I'm not going to get into politics, I swear to God. But my thing on is we're still learning so much about the virus. We still can't pinpoint exactly.
Well, it's mutating. Okay?
Right. So how do you
the virus from December, the virus now is totally different. And there's a new report yesterday that the virus in Malaysia now is reported an even stronger strain of it now. That's easier to catch and more dangerous. So it's mutated into you see that little picture with the red things, a little ball. Now it's changed shape. It's changed shape, and it's also got a different color for the organism that are attached to that virus, which makes it more deadly. So it's evolving. The vaccine is going to be hard. It's like the flu shot. Every year they come out with a newer one because it mutates every year. So this is the same thing with this virus. So this initial shot that they're creating now may not be effective for the new virus that's coming up now. Yeah. So that's scary, right? So
right. And that's maybe the second wave that we keep hearing is, we're not
right. Yeah. We're going to see this roller coaster for sure. New Mexico is, we're the top state in the country. We only have a less than 3% spread rate, which is awesome.
Because there's 45 people per acre.
Yeah, exactly. And we probably won't be the first state to get vaccines because our spread rate's so low. Yeah. So we'll be on the lower end of it, getting vaccines. Yeah, there'll be the higher states with the higher spread rate that'll be getting the vaccines. And so that's going to cause a mass frenzy. I mean, years ago when I was a kid, the swine flu. So and I remember my parents driving 4 or 5 hours to a location somewhere in California to wait in a 5-6 hour line to get the swine flu vaccine because of that pandemic that was going on back then. Yeah. This is going to create the same kind of thing here for sure.
Yeah. Wow.
Yeah, it's going to be, you're going to see lines and lines of people freaking out when that vaccine is released. There's some countries that actually already have it developed. I think Russia has a vaccine already.
It's vodka and a syringe. That's all it
is. Yeah, exactly.
It's Stoli. That's all it is.
Yeah. I have another question. So I had a pilot, and I want to get your take on this, said that, you know, you should be okay to fly, to travel, if you wear a mask and a face shield and gloves, and it's under 3-hour flight, and you know, don't consume anything. Would you agree with that or disagree with that?
Sounds like fun.
Well, so we know the air is recirculated in an airplane every 2 minutes. All right. So you have 2 minutes of stuff floating in the air. The mask should help you for sure. Goggles. I mean, only way you're going to get it in your eyes if you touch your face. Okay. But wearing gloves is a no-no. The gloves just spread it. You're touching everything in sight with those gloves, and then you keep touching things. The only way you can wear gloves is every time you touch something, take it off, put a new pair on. Touch something, take them off, new pair. But I see people walking around the community with gloves on. They've touched their car doors, their car keys, the door handles, and then they probably touched their face, touched their phone again, went into the store, touch, go to the checkouts, touch all that. Well, they'll touch their car again, and they go home and they've touched everything with those same gloves on. It's wrong. So yeah, so that's that. You know, I educate people. Get very mad at me all the time because I approach them with the glove issue. So it's not that gloves are not going to protect you. That's just my soapbox on the glove thing. But as far as flying, it's safe to fly. It really is, as long as you wear a mask. So I mean, really, if you hear somebody coughing up a storm in a plane, yeah, you could be concerned. Hopefully they have a good mask on. Again, a study came out just recently about all the different masks, and they went from the blue surgical mask that most people wear, and almost 0 particles came out. But the worst one was the bandana that people put on there. Everything came out. It just, you know, spores are just piling out of there. So bandanas are ineffective. 3 layers is what you need. So anything with 3 layers is what you need. So those cloth ones, the real thick cotton ones are awesome because they're built in layers. You know, you can feel them. But the ones that people are, those bandanas or scarves and things that people are putting over their mouth are not effective. So you just got to look at I mean, I guess I think both of us, you just look at your surrounding and who's doing what, who's wearing what, and who's, you know, and that's, you take yourself out of that situation. Because we've been in situations where we just leave because we're not comfortable. You know, absolutely. If it looks uncomfortable, then we shouldn't be there. And we leave.
Yeah. Well, even before this, my husband is he's not a germaphobe, but he gets really irritated. Like we'll be in a store or something, and there's a little kid with the, you know, the snot, and they're coughing their head off, and Tom's like, "We're out of here." And I mean, you know, if he hears somebody cough in Walmart, we're across the store. Like he's out of here. You know, this, and we've all said, even when this is over, if this is ever over, I don't know that I would ever go into Walmart again without a mask on. Because there are so many people who just, you see them and they're standing there like over the fruit. Like, are you going to buy all that fruit?
Right.
Because I don't want any of it now.
That's a fact. It's anywhere you go. Yeah. People are not conscious of their symptoms, and they don't really care. And so
I saw a great one, a woman who just during the pandemic, she's taken up charcoal, working with charcoals. She took a picture of, you know, she'd worked all day with the charcoals, went and looked and was cleaning up and looked up in the mirror and took a picture of herself, and her face is covered in fingerprints from the charcoal. It gave her a really good idea of no conscious memory of touching her face that much.
Right.
But
and that's an issue
all over.
And most people don't. So.
Right.
Wow. Yeah.
And that's the thing about, you know, the kids going back to school, is because kids are touchy-feely, right? And they always got their fingers in their nose and their ears and everybody else's nose and ears, you know. And, you know, their mask, it's just, it's going to be tough, you know, because they don't know that it's not their fault. They don't know social distancing. They don't know the ramifications of the virus, you know.
Right.
So that's why it's important. I think the video school right now, as pain in the butt as it is the best choice.
Yeah. Well, thank you. This has been super informative.
Kind of a bummer, but very informative. I mean, I'm just, you know, people.
Well, I've been working with the virus since day one, you know, and testing all these people, thousands of people, looking at all the symptoms they have. and seeing all these positive results come back, and you can pick them. I can just spot a person now that has COVID. They just look
Really?
they look ill. They're fatigued. They're tired. They're, you know, you don't even have to have a cough. They just look miserable, and they'll tell you so. They hurts everywhere. Their chest hurts. Their back hurts. They have a headache. You know, they're just so fatigued and tired. You know, you don't necessarily have to have a fever, and they just run down. And even post-virus, after they're back negative, their body is still changed. I have memory loss was one of the things as well.
Yeah.
That could be permanent. Yeah. So there's a lot of things, but I just noticed the symptoms. I've seen thousands of patients with the virus, and I just took it upon myself just to be really knowledgeable about it.
Right.
I want to protect my staff at the urgent care, protect my staff here, and my patients, and I want to educate them so they're not afraid to say they have these symptoms. It's all about education. It really is. A lot of people don't know what the virus is, or how it mutates, or how it spreads. The media does such a horrible job about it, you know. And so
yeah, instead of explaining it, they turn it into the boogeyman. And yeah,
correct.
Right. Yeah, or make it political, and it's got
Oh
nothing
yeah,
to
it's
do
political now. Yeah, absolutely. The election's going on. It's super political. So it's all about, you know, he ruined it for him, and why didn't you say this for her? And it just,
Right. Yeah.
the virus doesn't care though.
Exactly.
It don't care.
No.
Rich,
It don't
poor,
care anybody.
yeah, and it doesn't matter. Yeah. So yeah, a great equalizer. Yay.
Yay. Yeah.
Wow. Okay, so if folks want to reach out to you, if they want to ask questions, or
Make an
have a
appointment.
virtual appointment with you, how do they get a hold of you?
So basically, they could just, we make it simple. You can find us basically just Google search gmmedicalcenter.com, or Facebook, Instagram, all those avenues. They all have a book now button, and you're actually able to select your own time slot for your own medical or primary care appointment.
Right.
So we make it super simple, so you know exactly what's open for you. And with COVID, we noticed that a lot of people had more of an interest in their self-care routines, which led us to actually expand our practice here. So we're not only that, we're fitness and aesthetics as well, but we also took on an esthetician and a masseuse. We now have oxygen therapy, IV therapy, injections, everything now. So we're full medical center now.
Wow. Congratulations.
Yeah. Wow. So see, I mean, this is, again, every week we see this. People are finding brilliant ways to stay in the market, stay in business, stay moving forward, stay growing and changing, even in this weird atmosphere. So that's great. It's great to hear.
And I think it's because we keep our presentation on our clinic is awesome as far as cleanliness and sanitation and safeness. And they see that, and that makes them feel very comfortable and want to come back. And so that's key. And so we have implemented outside hand sanitizing station, one person in our lobby at all times only. That kind of, we take their temperature when they walk in. They have a pre-screening questionnaire they fill out prior or before they get seen by me. So so we make it difficult, but it makes it better for everybody else.
Right.
Fantastic.
Safer. Yeah.
Exactly.
Yeah.
Well, gentlemen, thank you so much, and please continue being safe. And thank you again for being on the front line. That's
in your service.
It's
really
easy for me to make comments over here. I tried very hard not to leave my little cubby hole here. Yeah, I have to drive into Albuquerque tomorrow and go to a doctor's office for testing. I'm like, can you just spray me with rubber and I'll be fine?
Right.
I need a whole body prophylactic, because I'm not, this whole idea of going out into the world is not my, no. So thank you for being there and keeping folks safe.
Yeah.
Thanks for having us.
Yeah, thanks for having us. We appreciate it.
Wow.
Yeah. We'll tag you in the post. So have a great day.
All right. Thank you.
All right.
Stay safe.
Bye.
Bye-bye.